Hello everyone, I am Dr. Mayukh Hazra. I secured All India rank of 29 in NEET PG 2023. I got admission into MAULANA AZAD Medical College and I left it. So why I left it? The video is already there. Go click the I button and see the whole video. Now those who have seen the whole video, now you would ask me, Dr. Mayukh, why this second part? Why you are making another video regarding the same topic? So I would say that some controversies arose, some questions arose, some misunderstanding arose. For that only, to clear all of them, I have made this second part. Now if you are new to my channel, do consider subscribing because I provide quality educational tips for MBBS, be it NEET PG, be it FMG, be it INI set also. And I also share a lot of clinical experiences also. Some of the vlogs also you would get in during my residency, during my internship, you would get in this channel. Now coming directly to the topic, so clearing all the doubts. Coming to the first point, I didn't leave MAULANA AZAD Medical College because of toxicity. I want to make it full and final clear. I told that HOD ma'am was a fine person and I didn't feel toxicity in 3 days. Yes, there was hierarchy. I mentioned that there was hierarchy. That is not there much in West Bengal medical colleges, but it was not toxic. I said that in general, the medical colleges in the central India and in the North India tend to be toxic a bit, because you can also see in the social media that many are leaving their residency because of sheer toxicity. And my one co-PGT is from Tamil Nadu and his one batchmate is in Bhopal. He's doing an orthopedics residency and he's not allowed to even sit. So that kind of toxicity is there, but I didn't feel. Now coming to the second point, that is telling Medical College Kolkata a mediocre college is, I would say, sheer idiocy. Because I want to remind you that it is the first medical college in whole of Asia. It is the first medical college. It is the first medical college to deliver medical education in whole of Asia. And it is also the first medical college where the first dissection in Asia took place in 10th of January 1836, and that day is celebrated as the National Medical Education Day. And you don't know the person who has conducted the first dissection. I pity your knowledge. So you should know a bit of history also, history regarding the medical science also. And leaving aside the rich history of Medical College Kolkata, now also if you see the standing, there is not much huge difference. If you see the NIRF ranking also, in NIRF ranking, MAULANA AZAD Medical College is in 35 and Medical College Kolkata is in 41. Only 6 positions difference. 2 years ago, the NIRF ranking of Medical College Kolkata was at 28. And when I took admission during my MBBS, if the NIRF ranking would have been there, it would have been a bit higher also maybe. During my admission, the India Today ranking was at 3. So there is not much huge difference. Yeah, infrastructurally, outside infrastructure, considering the outside infrastructure, MAULANA AZAD Medical College is superior. Now comparing the dermatology branches of both the colleges, because in residency you don't see the whole college. The whole college doesn't matter to you. Your department is the thing that matters to you, because from the department only you are going to learn. Means roaming about the whole college like during MBBS or having 19 departments during MBBS, that doesn't matter to you. The one department only matters. So comparing both the dermatology department branches, outside infrastructure, MAULANA AZAD Medical College is far ahead, because it was full centralized AC. The ward was also AC for the patient. The campus was also much larger and it was in a single place. In Medical College Kolkata, the department is AC, the OPD is AC, but the ward is non-AC. These are all at discrete places, so we have to run here and there. So that's a problem a bit. But coming to the academics perspective, Maulana Azad Medical College had two classes, but Medical College Kolkata conducts everyday class for PGTs, and one seminar of HOD sir is there, and regular interval quizzing and extempore is done, and marks are given to that. Means I have come in my first year and I have given my first extempore also without having much knowledge of dermatology. So the academics here is very much serious. So in academics, MCK is ahead. Coming to the instruments, MCK is a bit higher because both have NDA Ag laser, but Maulana Azad Medical College NDA Ag laser is non-functional, but in Medical College Kolkata it is functional. The procedural dermatology here is also very much good, and the hands-on is much more. Here intensive pulse light therapy is also there. We regularly do PRPs, so more or less same, but a bit ahead because the hands-on is a bit better. Now coming to the patient pool, I would say that patient pool doesn't mean that it's very much great. A fine balance should be there between the patient load and the doctors. Okay, so a fine tuning should be there. That too much less of a patient pool like in the private hospitals is also not good, and too much excess is also not good because it hampers your follow up of patient and focusing on each patient. Like in AIMS Delhi, they see only 100 to 200 OPD patients. They have limited admission and they do quality care. So that is also very much important, that you have certain number of patients and you can follow them up and improve their quality of life. It was a bit better, I think, in Medical College Kolkata. In Maulana Azad Medical College, the load was slightly excess because the OPD rush was really great. There in the OPD, about 1300 to 1500 patients we had to see, but in Medical College Kolkata during the winters is about 550, and during the summers it goes about 1000. So a bit more balanced, I would say that it's in Medical College Kolkata. It doesn't mean that Medical College Kolkata dermatology should always be placed before Maulana Azad Medical College dermatology. The one biggest plus point of Maulana Azad Medical College dermatology is being it a central institute, there is no bond. So no bond institute should always be preferred first, I would say that. Your choice should not differ according to why I left. Coming to the third point, I didn't leave Maulana Azad Medical College for only one factor. I have mentioned in my video all the three factors, and if you have certain knowledge of community medicine also, you know that there is something called multifactorial causation. So all those three factors and some more factors along with the temporal association played an important role for me leaving Maulana Azad Medical College. And if you ask me, do I regret my decision, as I have said in my previous video also, that I don't regret my decisions. And some things before going to Maulana Azad Medical College I didn't knew, means it was new to me and I didn't have exposure to those things, and that's my lack of knowledge. I feel that in Delhi, the Central Institute 3-year SRship is mandatory for being an AP. So you have to do their 3-year SRship to become an assistant professor, but in state it's 1 year. And in state, if I completed my degree from Delhi and did my SRship here, it would have been difficult because being bonded SRs, the bond SRs are there, so there is no vacancy in the Kolkata based colleges. So I would have to go into the peripheral colleges, and having contacts, having the channeling, it would have been very much difficult. Like I am having the channeling starting from my 1.5 months only, and as the time goes now, the channeling goes better. The channeling with medical representatives is also important because at a lot times they help you up in setting your clinic, or they can tell the location where you can practice better. So it's also important. And if you do the practice in the state college only, or where you want to settle, these factors are there that proves to be beneficial. I didn't know, and I don't regret my decision because I am enjoying my residency. I am doing a lot of CMEs. We have monthly one CME at least. We have RTMs also. I am not going to say what is it. I'm also learning to do a lot of procedures. I am doing iontophoresis, ILS, using dermal roller, and the next week I will also learn to use the laser also, the laser gun, the microneedle surgeries, the microneedle excisions, excision biopsy, radiofrequency ablation, electrocautery, cryosurgery, and many more things. So I am learning a lot here, though I am not getting time to study. Means I am not studying, I am focusing on the YouTube and all, and more of enjoying. I am doing conferences, and recently I went to the state conference of QTCon. So this is the IODVL batch also I got there, and I would soon release the video on YouTube also, so stay tuned. And I am coming to the end of the video. Before ending this video, I want to share you one announcement that I have started members only videos also. So if you see the subscribe button, just subscribe it at first if you haven't. So beside the subscribe button, just lateral to it, there is a join button. And if you want to join my channel, become a premium member, subscribe to my pro pack, then you can select the join button, because number one thing you will get is loyalty badges that everyone provides. Number two you would get is members only videos. The members only videos I would provide twice monthly, and if you can see that one members only video is uploaded now only, that is regarding rheumatology. The whole of rheumatology I have concised into 3 pages, just 3 pages, and I have mentioned all the past 5 years questions from, be it INISET, be it NEET PG, or be it FMG. So 42 PYQ points I have got, and I have mentioned them, and the way I have represented, I think it's very much helpful if you see it. Third thing I am providing is the members only Telegram channel, where you interact with me one-to-one, and I have kept the price as minimum as possible, as minimum as the YouTube allows me to keep, that is only 29 rupees per month. So if you think, you can just join to my YouTube channel, or else that it's completely fine. तुम लोग तो मेरे सब्सक्राइबर्स हो ही, और सो आज तक के लिए इतना ही. टाटा, गुड बाय.